Dr. Paul Lockhart here again from Kogarah Chiropractic. I've been a chiropractor for over 37 years and acupuncturist for over 27 years. So I'm going to show you some techniques today that's going to help you to be able to help yourself at home. And also going to help to be able to alleviate the confusion about whether we should be using heat or cold when you have lower back pain. I'm often asked, what is the most common cause of lower back pain? The most common cause of lower back pain these days is sitting down. We are not designed to be sitting down for several hours at a time. We're designed to be up and moving around. So it's when we're sitting down that the leg bone here, the femur, fits into the pelvis in here, into the joint, the hip joint itself there. And that creates problems in the sacroiliac joints, which then creates problems in the lumbar spine. So if you have pain in your lower back, and Carmen here is an office worker, and Carmen, can you tell me where your lower back pain is?
Right here.
Yeah, so the area we tend to call the flank or the lower part. Thanks, Carmen. So Carmen, it would be tender in here. She can work around this bone in here herself then. Okay, can you put your thumb on there, Carmen, and work that then? It's the joint in here, which is obviously more obvious on a female. Work around in here. You can work those. Some parts will be more tender than others, right?
Yeah, right here.
Okay.
Should I be rubbing around it or just where the tender spots?
I would go the whole way around that, but concentrating more on the most tender spots though.
Oh, yeah.
So when you're at home, you can work on these points in here. I would adjust the position of the leg bone in here. This is going to be beneficial for you at home in any case. We're going to go to the sacroiliac joint, because the problem in here, in the hip joint, will create a problem in the sacroiliac joint, which will then create a problem in the lumbar spine. So there's some tender spots along in here, so you can work in, this is the actual sacroiliac joint itself, so you can work on the sacroiliac joint there until it starts to ease up. Don't do it too much to create more of a problem in there, but it should be quite tender in there. Just work on it until it starts to settle down a bit. Joint in here, can you feel up in here? You'll feel the bone here. Okay, so just above the bone there, that's the area there. So you can work on that too. So you go along the whole joint in here. So I'll give you a helping hand there then. Let me help you there. It's along there. Okay, so along there.
Yeah.
Okay, right, because there, you're also going to put the ice pack on there later on as well.
Is it like where the dip is?
And where the dip is, just above the bone.
Oh.
Okay, it'll be tender there.
Yeah.
You'll also find it's tender below the joint in this region here.
It's on the, right here.
Yep. So you can do this work yourself. You can just do the work in here, just slowly using your thumb pad or your finger pads on there to work the muscle there to your own tolerance as well. A major acupuncture point is right in the middle of your butt, right in here. Okay, if you put your thumb on here, you'll find like a little dip there.
Oh.
Yeah, you can work that point, an extremely important acupuncture point for lower back pain. The other one is on the side there, between the hip bone here and the waist bone in here.
Right here.
Yeah, it'll be in there too. So you can work on that yourself. The next ones you're going to work on here, Carmen, are on either side of the spine through here. So if you can put both thumbs on here, then you're going to work up and down through here, along here. Yep. So you're going to go up and down. Again in here, up and down the spine, rather than going around. Work up and down. That's like that. There. Good. So there are acupuncture points along in here as well.
So right in line with my waistline.
Right. Very good. Just a little bit above there and a little bit below there. They're the most important points. You can go up even higher if you want to, and up towards the lower part of the ribs, and rub around there as well. Now, in terms of heat packs or ice packs, if I was to put my pen here on the sacroiliac joint, that's on an angle here, you want to get some ice cubes, wrap them up in something like this in here and put them in a plastic bag then. That goes on there. For a joint, you want to cool the joint down. You don't want to heat it up. You want to cool it down in here. The muscles in here in Carmen are tight, and they are tight to protect herself from herself so she doesn't create more of a problem in this region in here. So we want to warm this up then Any female who's had period pain knows it feels nice and soothing if she puts a heat pack on her abdomen there. So if you put the heat pack on here, on the muscle here, put the heat pack on the muscle here, that's going to give you a lot of relief for the muscles. But we want to make sure we do the work on the joint itself first. Because if we relax the muscles in here and in here, which are there to protect Kogarah from doing things too quickly or too strenuously, they are tight there to protect her. We want to make sure we cool the joint down first, do some rubbing on the joint in here, and then put the heat onto these areas in here of the muscles which have become too tight. At the Kogarah Chiropractic, I would adjust the joint to get some normal motion back into here, also the hip joint here, and I would use a microcurrent stimulator on these points in here. You don't have this, but you can still stimulate the joint by rubbing on it though and cooling it down. If I can help you out at all, if you want to know more information, if you're unsure about where to rub, please give me a call here. I'm Dr. Paul Lockhart at Kogarah Chiropractic.